One of the most important steps is for the healthcare provider to think, am I comfortable talking about this disease? I'm not even going to say treating, I would say talking about this disease first and explaining to the patient disease course, treatment course, then asking yourself, am I comfortable treating this? And third, am I comfortable committing to this patient? So CTCL is technically skin cancer, so it's a skin lymphoma, but at its lower stage, patients can have extended survival and normal lifespan. But when the word cancer is heard, patients can be very scared. And so it's important to have an experienced healthcare provider who understands the course of this disease and can advise the patient appropriately on what to expect. Additionally, staging needs to be performed, and the staging depends on the type and extent of skin lesions. Also, the provider needs to know how to stage the blood and be able to run and interpret blood flow cytometry to determine whether there is blood involvement. And in addition, I would like to collect the signature of these abnormal cancer cells in the blood to see whether there is a molecular signature present, which is also important for staging. Additionally, routinely in other lymphomas, we do CT scans or PET scans to determine the staging in the lymph nodes and viscera, but actually those studies are not always necessary in cutaneous lymphoma. So again, the provider needs to be comfortable with understanding the disease to know whether initial imaging and then subsequently sequential imaging is even necessary, because unnecessary imaging can generate false positive results, can generate a lot of anxiety in the patient and kind of create this cancer stigma and living with cancer burden on these patients, while really patients with stage 1A disease, which is disease involving less than 10% of the body in the patch stage has excellent prognosis. And it's really a pleasure to explain to these patients how well they can do and bring them relief, because a lot of times they're anxious and scared. So CTCL patients need multidisciplinary care in many cases. And the reason why is because, yes, some of them will require only topical treatments. And some dermatologists are comfortable and very comfortable managing topical treatments and managing light therapy, while other dermatologists are not comfortable doing so or do not have time for enough follow-up. So I would say in lower stages of disease, where there is only cutaneous or only skin involvement, dermatologists may take a lead, but not always, because there's always not always a dermatology provider who is comfortable with this disease. And in many cases, the malignant hematology expert with an interest in CTCL can take a lead in this disease. Best follow these patients, especially the ones with cutaneous involvement and active cutaneous involvement, follow these patients in parallel with dermatologists. Additionally, these patients may benefit, and some of them benefit from radiation therapy. So again, prompt and appropriate referrals to radiation therapists are very important. Additionally, patients with CTCL at various stages may be profoundly immunocompromised, especially patients with Sézary syndrome. So it's important to have an infectious disease specialist communicating with the lead hematologist who is aware of these patients' baseline immune function, who is aware of the specific infection risks that they have, and who is available for referral if necessary. Additionally, these patients may experience emotional problems, as this is a lifelong incurable disease, and it is useful in many cases to have a psychologist or a psychiatrist who can participate in care and help these patients with emotional relief from their disease burden.